Welcome to the series Minerals for Whole Health, short lessons on the minerals that keep our bodies functioning optimally. I'm Thomas Lemke, registered dietitian and the clinical director of Whole Health. This installment is about iron. Iron, as you probably know, is a metal element found everywhere on Earth, and deep inside the Earth, come to think of it. On the periodic table of elements, it bears the chemical symbol Fe for the Latin word for iron, ferrum. When iron is metabolized by our bodies, it is incorporated into the structure of organic molecules that carry out necessary biological functions. Here are a few examples. You've probably heard of hemoglobin. Your doctor may have even drawn labs to check how much of this is in your blood. Hemoglobin is the molecule within your red blood cells which has an affinity for oxygen and transports it around your body through your circulatory system. Because of the iron in it, hemoglobin turns bright red in the presence of oxygen and is responsible for the color of your blood. Myoglobin is a molecule that, like hemoglobin, is capable of binding up oxygen for later release when oxygen runs low. It is found in cardiac and skeletal muscles and allows the body to temporarily adapt to short periods of time without taking in more oxygen through respiration, such as when you hold your breath. Cytochromes are mostly found in your mitochondria, the power stations of your cells, where they are responsible for running the electron transport chain. The iron in these molecules is used to essentially push electrons around in a series of reactions that create energy for your body to use. Very important. And then, of course, we have catalase and some peroxidases, which catalyze various chemical reactions throughout the body. Some of these reactions are used by the immune system as weapons to attack pathogenic invaders, and others serve to disarm these weapons so they do not damage your own tissues. In another case, thyroid peroxidase works with iodine to produce thyroid hormones. Iron is also involved in DNA replication and repair, cell division and growth, reproduction, and healing. But this list is getting pretty long, so let's move on. When you don't have enough iron in your body, you lose out on all of those great functions we went over on the previous slide. Your immune system suffers, your thyroid can't produce its hormones efficiently, your mitochondrial energy production goes down, and of course, you can't produce healthy blood cells capable of moving oxygen around your body. Put all of that together and you have the syndrome known as iron deficiency anemia. The symptoms are listed as you see them here. Obviously, some of these symptoms are very generic. If you suspect that you may have iron deficiency anemia, talk to your doctor about concerns. He or she can draw some labs to confirm or deny those suspicions. There are several groups which run the risk of iron deficiency. Pregnant women need additional iron for the child they are gestating, of course, and menstruating women lose iron via the blood loss. Children are growing rapidly and need plenty of iron. The elderly have difficulty absorbing iron due to age-related changes in the GI tract, including loss of the levels of stomach acid required for iron absorption. Speaking of, be advised that the use of proton pump inhibitors and H2 blockers with their stomach acid lowering effects can also induce an iron deficiency over time. Same with diseases of the GI tract like celiac disease, which presents as a syndrome where the absorption of iron is impaired in the intestines. Vegetarians and vegans are at risk due to avoidance of heme iron containing foods. Heme iron being that animal source iron which is more easily absorbed than plant source iron. Endurance athletes run through red blood cells more quickly, and dialysis is complicated by both hormonal changes and some blood loss, which results in higher turnover of iron stores, and thus increased risk of deficiency in those groups as well. When it comes to daily needs for iron, we have the following. For men, 8 milligrams each day will do the trick unless you've lost a decent amount of blood and need to replenish. For women of childbearing age, they are losing a decent amount of blood each month that they are not pregnant or on some type of menstruation pausing birth control. In these cases, the need is 18 milligrams per day. That goes to 27 milligrams per day during pregnancy and 9 milligrams per day during lactation. For women after menopause, the need drops to the same as that of a male at 8 milligrams per day. Sources of iron are divided into two groups. Heme, think blood origin as in hemoglobin, and non-heme. Heme iron is vastly superior to non-heme in terms of absorption, which is great if you're low in iron and not so great if you're high in iron. Heme sources include bivalves, namely oysters, clams, and mussels, beef or chicken liver, canned sardines, beef, poultry, canned tuna. Non-heme sources include fortified cereals, beans, dark chocolate, lentils, spinach, nuts, and seeds. Regarding the more poorly absorbed non-heme iron, consuming a source of vitamin C at the same time as that food containing iron will increase absorption, while calcium consumed at the same time as those food sources containing non-heme iron will reduce absorption. Iron toxicity is rare as the body will adjust the rate of iron absorption based on what stores are currently available in the body. However, iron toxicity is known to happen most frequently with supplementation, where vastly more iron than the recommended daily allowance is being consumed, and with certain genetic mutations that cause a condition called hemochromatosis and allows iron to build up to toxic levels in the body. Common signs you are consuming too much iron include constipation, upset stomach, nausea, and vomiting, and abdominal pain. The treatment for high levels of iron involves blood donation on a schedule determined by your physician. Thank you for viewing the iron installment of Minerals for Whole Health. We'll see you around.